smile with you.
Hi, everyone. I'm Leslyn Keith. I'm the president of the board for the Lipedema Project, and I also do a lot with Lipedema Simplified. And I am so happy to be here today with my friend and colleague, Brenda from Lympha Press. Brenda, hi, welcome.
It's so nice to be with you again. It's so nice to be with you. I love all the things you say and do. All right. I'm sorry. I should not be singing, but maybe it's good for ratings or bad for ratings, Leslie.
It just makes me think of our friend Judy, who she sings her way through life. You may have seen her on some of our other webinars and stuff. Judy does, it's all singing. So it's okay. I think it's part of this group.
Well, it feels like a party every time we get together because we have so much to celebrate. And first of all, we as Lympha Press, by the way, if you don't know what Lympha Press is, we are pneumatic compression pump therapy. Mm-hmm. And we are so honored and proud to, again, sponsor one of your events. And I love the name of this one, which is Lymphedema and Lipedema.
Right. So it's Innovative Solutions for Lipedema and Lymphedema, our virtual symposium that's coming up this next weekend. And as usual, Lympha Press is one of our main sponsors. They have really supported just about everything that we do at Lipedema Simplified and the Lipedema Project. So we're thrilled to have your participation again. We love working with you guys. Such a wonderful product, and so many things that Lympha Press does to support the lipedema and lymphedema community. I've been participating in, Brenda, you have those roundtables, a lipedema roundtable, a lymphedema roundtable, once a month that get together and just have discussions with the community. Just a lot of support interaction with the community besides having a spectacular product.
Well, this is what's so cool about our collaboration with your organization. We both realize that lipedema and lymphedema are conditions that affect the whole person, not just physically, emotionally, mentally, spiritually, in so many ways. And we at Lympha Press believe that, after we provide you a pump, and before, even if we haven't provided you a pump, you need support. And we are in full agreement with you and the wonderful Dr. Seo that it is important to do this journey together. Mm-hmm. So our roundtables, the lymphedema roundtables, are on the second Tuesday of every month at 8 p.m. Eastern Standard Time. Lipedema, third Wednesday of every month at 8 p.m. Eastern Standard Time. And you can just go to lymphapress.com and you can easily see how you can register for those roundtables. It's patients mostly talking about how they are managing their condition effectively, how they can encourage each other. They are very candid and open about the battles they face, the struggles, the downtimes. It's not all sunshine and rainbows, as we all know. Mm-hmm. But if you can see yourself or hear yourself in someone else and know that you're not alone, that's what it's all about. And that's why we love what you do. And so it's such a perfect collaboration because so many women, and I say women because lipedema is primarily a female-oriented issue.
Yes.
And those with lymphedema are in search of hope and answers. Mm-hmm. And you definitely provide that with your organization. And we have seen dramatic and amazing, life-changing for the better results with Lympha Press, pneumatic compression, vernacular, the pump.
People and Brenda,
wonder, what is it? It's a pump.
Exactly. And Brenda, and I think that probably most people watching know about what pumps are, but there are going to be some people that have come upon this and they're looking for another tool, something that's going to help them manage their lipedema and or lymphedema. What is a pump? What is that?
And the last time I tried to explain this, you actually jumped in and saved me because you did an even better job. I mean, you are mad props to your clinical knowledge. I am a marketing person. I will tell you the very simplified version, which is we have garments that you put on just like a jacket or pants or boots. You zip them up. They're super easy. Then they're attached to a pump, which is just a very small device with a handle on it. You can carry it around if you want, depending on what the version is that you have. Press a button and it then fills with air. What I love about the Lympha Press is it fits to fill. First of all, you don't have to deal with a bunch of straps and things like that. You just put it on, zip it up. Then the air fills up. It fills to fit, and then depending on the device you have, can sequentially move that air. So it's basically massaging your limb. And what's the
Yes.
point? To move the lymph or to
Yes.
break up the fibrosis? There are different pressures. Now, a lot of people set it and forget it. Your doctor sets the pressure that's right for you, and it'll feel good, and it will squeeze. You'll feel the squeeze either sequentially, or we have a peristaltic, which is a
Yes.
wave, which is a different type of massage.
Mm-hmm.
Anyhow, the point is it is moving. Your heart has a pump built in, right?
Mm-hmm.
Your lymphatic system needs to be pumped if it is stagnant and the lymph isn't moving. So it's just, if you can't physically get out there and do a lot of exercise, a lot of people are immobile or challenged with their mobility.
Mm-hmm.
I say to many there are some doctors I've talked to that have said, it's better for people to get out there and do exercise. And I say, yes, but if they can't, the pump can stimulate the lymphatics in a way that they can be sitting in the comfort of their chair, sitting watching TV, playing on their cell phone or their iPad, getting therapy to move the lymph, and then reducing the weight. Lymphedema, lipedema is like carrying weights around on your
Yes.
limbs.
Yes.
If you can lighten that load, then there's a better chance that these patients are going to be able to get out and be more active. We've dealt with patients that couldn't walk to their mailbox before,
Mm-hmm.
and now they're running in they're participating in triathlons. Now, that's not everybody's story, but we will meet you where you're at, just like your organization does, and we'll work with you, and we'll get the right device. We work with most insurances. We certainly work with Medicare as well, and we will get the best pump, the easiest to use pump for you, that won't just sit in a closet and collect dust because it's too hard to use. It's not loud. It doesn't make a lot of noise. You can have a special area set up in your home. That's my pumping area. This is me time. Many of our patients say, this is me time, where I want to take care of me, and put your good music on and just chill and get therapy. You don't have to necessarily go in to the doctor. We work with therapists. The therapists do such amazing hands-on work with patients. They want that work to be maintained when the patient goes home. So having a pump, having a Lympha Press can help you maintain the progress that your wonderful therapist has achieved in clinic or in their practice.
Yeah, because when you are getting treated by a therapist in the clinic, it's a concentrated, intense time, usually 5 times a week, up to 5 times a week for several weeks to get everything reduced. But it's not like you're just done at that point. You have to have a way to be able to maintain what you achieved in therapy and hopefully maybe even progress and get even better results on your own. And that's a tool that pump provides.
Yes, you're preaching to the choir, but I also hope that your listeners and viewers out there, by the way, thank you for tuning into this Facebook Live. We are so glad that you are with us today. And we hope that you're going to come this weekend to this amazing symposium. We'll have a booth at Lympha Press. You can come and visit us. I will be there live along with some active patients who are using the Lympha Press. It's one thing for the marketing person to say something, but when real live people with real results are there and you can ask them questions, it's golden. So we love that. We're going to have patients in our booth with us. But to your point about progress, one thing that's unique about the Lympha Press is it will progress with you. We will achieve results. You'll receive some reduction, some lightening of the limbs, but because it fills to fit, as you get better, the pump will continue to work with you.
Still
It's
going to be
not
working on you. Yes, yes.
exactly.
And we saw several people, I don't know if you saw this, Brenda, but several people have posted. Linda posts, I agree, those compression pumps are wonderful. Julie says, love my pump, so easy to use and it feels so good. And you know what? Sometimes medical treatment doesn't have to hurt. Sometimes it feels good. This is a prescription item that is, quite often, as Brenda said, is covered by your insurance. Your doctor has to order it. This is a prescription item, and it is something that is going to be so useful in helping to manage your lymphedema or lipedema. It's like a mechanical way of doing the massage at home. And I just wanted to point out some of the huge benefits for lipedema. One major one is pain reduction. Women with lipedema tend to be very, very tender, hypersensitive. There's a lot of soreness, a lot of pain. The gentle massaging that this pump does can help reduce that pain. Maybe it's because it's helping to reduce inflammation, helping to get fluid out of the tissues. We're not sure exactly what the mechanism is. We just know that it helps with that. It helps reduce fibrosis. You can have very, very firm tissue with lipedema, and this is going to help soften that tissue. So there's just so many good benefits for the woman with lipedema.
Yeah, I'm so glad you mentioned the fibrotic aspect of it, because you can't break that fibrosis up unless you have the ability to increase pressure to a certain point. And I am a firm believer that pressure is not something to be afraid of. Now, certainly listen to your body, listen to your doctor, first of all, and listen to your body. But with the Optimal Plus in particular, we are able to get to pressures that really can get in there and untrap the fluid, because the lipedema traps it. And getting it untrapped so it can be eliminated. We have heard about increased mobility, reduced pain, and overall improved quality of life. And in some cases, dramatic reduction. Although most of the women with lipedema I speak to, that's not priority number one. It is about having a good quality of life. One of my dear friends, Kelly Maynard, had amazing results. And she's going to be in our booth, and she will be attending the symposium this weekend. She really wanted the Lympha Press for quite a while. And we work very closely with doctors' offices to make sure that we have the right documentation so it can be submitted to your insurance department, your insurance company, and obtain as much coverage as possible. And when she finally got it, she was committed. Now, she had a child 7 years ago. And with lipedema, pregnancy, menopause, puberty, all these hormonal junctures are often triggers for the condition. So she had her child and gained 50 pounds like that. She's a healthy person. She monitors her intake of food. She exercises, everything. Nothing could move the needle. She finally gets a Lympha Press after 7 years of not being able to reduce anything. And I always add the caveat, these are not results that we can promise for everyone, but she was diligent using her Lympha Press. She had both upper and lower extremity garments. In 1 month, she lost 30 inches and 20 pounds. She was in Walmart. She doesn't own a scale, right? So she's like in Walmart after using her Lympha Press for a month. She said, let me just pull down one of the Walmart scales and just see. And she thought, this can't be right. So she pulled another scale down and got on it. And the third time was a charm. And she's like, oh my goodness, I really lost 20 pounds, which is so heartening. She felt like she got her life back. And that was after just 1 month using her Lympha Press. And I have heard varying stories. Kelly Maynard is her name. She will be in our booth this weekend. Please come and ask her questions. We're excited for you to talk to her. So
and the pounds that she lost was the least of it. Of course, she's thrilled about that. But, it's just she feels so much better. The volume is so much reduced that she has so much better volume. So it's pretty
On the
spectacular.
practical level, many women with lipedema, they have children and the children want to grab them around the legs and give them a
Yes.
hug. And it's like,
Yes.
oh, it hurts.
Yes.
To be able to enjoy those simple pleasures again. She can wear her wedding ring again.
Yeah.
Simple pleasures. Interestingly, she can sweat again. She had stopped sweating. Her system was so clogged that sweat was trapped. And that's a great way of releasing toxins in your body. So she's sweating again too. Simple things that some of us may take for granted or say, oh, I wish I could stop sweating. I get hot flashes all the time. But she is seeing changes in her life. And that's what's so gratifying. Honestly, you can tell if someone's blowing smoke and if they really are just trying to whip you up and sell you a line. And the truth is, before I started to market the Lympha Press, particularly the Optimal Plus, which was specifically designed for lipedema and is indicated by the FDA for the treatment of lipedema, I said, let's see if it really does what we think it's going to do. What the FDA cleared it for, we want to see how it really works on patients. We didn't even start marketing it until we had tested and trialed it with 4 different patients. And we had them chart their progress, pain, mobility, reduction, and all 100% across the board. We saw actual results. So then we said, okay, ladies and gentlemen, start your engines. We are going to tell the world about this. And that's why we just love partnering with you, because you are our audience. You appeal to the very people we're trying to help. We don't want to create false hopes. We can give you real hope.
Yeah. And sometimes a big hurdle to get through is going through your insurance company, because I mean, it's not cheap, although Lympha Press will work with you. Yes, Christina, it is covered by insurance, but Cheryl comments that she's still fighting her insurance. Each insurance company has their criteria. Generally, it's very similar, same criteria to make you eligible for getting a pump. And so the team at Lympha Press, they're skilled at that. They know what needs to be done. They know how to get the documentation. They know how to help your medical providers in order to gather the correct documentation. So they will help you. So Cheryl, I don't know if you're going through Lympha Press, but the team there is ready to help you get that through your insurance, because we know that it has results.
Yes.
We know that this is going to be a valuable augment to your home program. It's going to help you be able to control and manage and hopefully improve that lipedema better. So they will go to bat for you. They will help you. Yes. They will support your medical team to do what needs to get done in order to get you this product.
I'm so glad you said that. And I'm so grateful for the question, Cheryl, as well, or the comment, because, it does take a team. And we have an amazing team. My title, aside from the marketing person, is Lipedema Patient Advocate.
Yes.
And we will fight for you. We care. And we also want to tell your audience too, many times you will be prescribed a pump. Please know you have a choice. You can say, I want Lympha Press by name. Not all pumps are created equal. And I would never disparage another company or another product. I just know, I hear over and over again, people that had other pumps now have a Lympha Press and say, it's like night and day. It's so easy to use. I love my pump. We even have a t-shirt that we give people that are passionate about their pump. I love my Lympha Press. We did a photo shoot recently. I got to tell you this. We used actual patients in the photo shoot. And the photographer said, you're a little too smiley around here. And, as a confessed smiler.
Yes.
That, sometimes people wonder, how much coffee did this woman have?
Yeah.
But I have to say, our patients do smile because they're happy.
Yes.
So please, if you are prescribed a pump, take a look and make sure it says Lympha Press. And if you have any further questions about it, please, we would love to answer them, because knowledge is power. bviola@lymphapress.com. You can email me personally. I will connect you to your local representative. Do not assume that all pumps are created equal. They are not. And we would love to be able to show you the difference.
Yeah, and I have to say that every time I have someone who emails me and has a question about a pump, and even in different countries, how can I get one? I don't know what to do. I contact the people at Lympha Press, and they say, "Oh, I know somebody in Portugal we can hook you up with. I know somebody in Australia I can hook you up with," and they're going to help you wherever you are. I say we're probably mostly concentrated in what countries, Brenda, for Lympha Press?
Well, here's what's so great. It's like you read my mind, because one of the things I wanted to mention is that Lympha Press is not a new brand. It has been in existence for over 40 years.
Wow.
And we are in, I believe it's 37 countries.
Wow. Yes.
All around the world. If you go anywhere in the world, they know what Lympha Press is.
Yes.
We're going to do a better job of making sure everybody in the United States knows what Lympha Press is, but it has been the leader in pneumatic compression throughout the world. Germany is huge. England is huge. Spain. We're coming out with our 2022 calendar, and the theme of the calendar is a world of difference, because we want the different offices that we work with to know we are worldwide. We have a deep history and a rich history of leading in pneumatic compression. And we did some fun things. We took our reps' faces and photoshopped them into Brazil doing the flamenco, or seeing the northern lights in Iceland, or all these different worldwide scenarios. So that's actually one of our themes of the year. And aside from the fact that we make a difference around the world, we make a world of difference in the lives of the patients we serve in the United States and throughout the world. So
yeah, and this is another reason why it's so neat to partner with you, Brenda, because Lipedema Simplified and the Lipedema Project, we work online. We're reaching a global community, and we're connecting that community of women with lipedema together, and to be able to talk about a product like yours and know that someone in South Africa, someone in Belgium, someone in Hong Kong is going to be able to get the product is so, so valuable. So thank you so much for being here with me today. Thank you so much for supporting us in all of our symposiums that we do, especially this one coming up this weekend. It's wonderful to talk to you as always, Brenda.
Thank you so much. An honor. And thank you, everybody out there, for tuning in. I really hope to see you at the Lympha Press booth this weekend. Can't wait.
Yeah. Thank you so much.